3 News Now Web Extra.
So the White House you're getting ready to enact some new requirements for employers and employees in terms of vaccine mandates. Could you outline those requirements for us?
Sure. So the president on September 9, and when he released his 6-point plan for this next phase of dealing with the pandemic, a key component of this plan is to make sure that we have good, bold vaccine requirements plans in place. And there are 3 components to the vaccine requirements that the president announced. For employers with 100 employees or more, those companies will be required to make sure that every one of their employees is either vaccinated or getting tested at least weekly. That covers about 80 million workers in this country. The second part of the vaccine requirement plan that the president announced covers healthcare workers who work in organizations that receive Medicare or Medicaid funding. And those folks will be required to get a vaccinations with no test out option. This requirement will cover about 17 million people across the country. And the third vaccine requirements is for federal workers and for federal contractors. And those folks will also be required to get vaccinated, and that covers about 3.5 million people. So in total, the president plans cover about 100 million people in this country. That's about 2/3 of workers in this country.
And when we're talking about employers requiring employees to get vaccines, and I know that there's a major employer here in Iowa and Nebraska, Tyson Foods already has enacted that mandate, and that was one of the success stories that your department actually cited. What is there a fear with the challenges with recruiting, for instance, with recruiting employees, that requiring those vaccines will make it just that much harder for employers to find skilled workers?
Well, look, what we've seen over the last several weeks is that hundreds of companies, healthcare organizations, universities put vaccine requirements in place, and we're seeing how well these vaccine requirements are working. You've mentioned Tyson Foods. Before they have their vaccine requirements in place, less than half of their employees were vaccinated. Today, more than 90% of Tyson Foods workers are vaccinated. Take United Airlines, for example, from 59% up to 99% in 2 months. Active duty military from 79% to 94%. And you have examples after examples in healthcare systems, other companies, universities with more than 95% vaccination rates. We know vaccine requirements work. We know they are the right thing to do. And we know that the American public support vaccine requirements with survey after survey and poll after poll.
And I take it with that, does your department have some statistics that in terms of, so the requirements work in terms of getting large numbers of people vaccinated. Does that also reduce the transmission of COVID-19 by requiring those vaccines?
Well, we all know that we want to work at places that are safer for workers, safer for customers. In the healthcare space, we all want to go to places that are safer for healthcare workers and for patients. And we know when you're vaccinated and you're surrounded with people who are vaccinated, you're much less likely to catch the virus and much less likely to spread the virus to other people. So we know this works. Now, on the transmission data, we have to continue to track the science there, track the data, and we'll make those data available as soon as they are. But make no mistake, if you're unvaccinated, you continue to be 5 times more risk to catching the virus. You're 10 times more likely to end up in the hospital, 11 times more likely to die from the virus compared to someone who is vaccinated.
And it's my understanding that OSHA, with the Department of Labor, will be enforcing either the vaccine mandate or the testing mandate. Are there concerns about the capacity of OSHA to handle that? I mean, how will that be enforced?
Well, the Department of Labor and OSHA are putting together the emergency temporary standard. They will be issuing that in the coming weeks. And just like all other emergency temporary standards that OSHA enforces, they will be enforcing this one as well. So we'll continue to track that and we'll see how would that evolve over the next few weeks.
Do you have any concerns about there are going to be some exemptions, I think, for the mandate, or do you have any concerns about people taking advantage of those exemptions, or perhaps trying to qualify for an exemption when perhaps they really don't, but they're fudging it a little bit? Has there been any evidence that that's happening, or do you have any concerns about that?
Well, I can't comment on the rulemaking process that OSHA is in right now. So we'll wait until the emergency temporary standard is put out, and then we'll be able to comment on it. But I have to tell you, when we're looking across the country with healthcare systems that have adopted those vaccine requirements, companies that have adopted vaccine requirements, we've seen very high percentages of employees adopting and getting vaccinated. And that's the type of outcome that we'd want. So we'll continue to track that. And as we learn more, we'll be happy to share with the public.
Is there any reason the administration is focusing too on larger employers and not smaller employers?
Well, look, our message is for all employers, irrespective of your size, to make sure that your employees are getting vaccinated. The Secretary of Labor has decided on employers with 100 employees or more for that emergency temporary standards to apply for. But our message is to all employers, whether you're an employer of one or an employer of 100 or 100,000. We'd want to make sure that we do everything we can to get these employers to get their employees vaccinated so we can create safer environments in the workplace for people who are working and for customers. This is the right thing to do.
I know you have to go really quickly. I wanted you to just talk about vaccine mandates, if you have a second, because I don't think that that's a new thing in healthcare. Are there other examples of vaccine mandates working, or what are some examples of vaccine mandates working?
Well, vaccine requirements in the healthcare space are not something new at all. You know, I'm a family doc. I had privileges in many hospitals throughout my careers. I've worked in many healthcare systems, and I always had to abide by certain vaccine requirements. You look right now, you know, you need to be vaccinated for mumps, for rubella, for measles, for hepatitis B, and many others. So it's really important to make it very clear that vaccine requirements in the healthcare system space is not something new at all. We'd want to make sure as the public, when you're interfacing with the healthcare system, you'd want to trust that you are in a safe environment, safe for patients, safe for healthcare workers, and vaccines are important to make sure that we're protecting ourselves and protecting others from COVID-19. That's why vaccine requirements, particularly in the healthcare space, are so critical at this point.